Hi, I'm Dr. Howard Goldberg. I'm a licensed chiropractor in the state of Massachusetts for the last 28 years and now a certified animal chiropractor from the American Veterinary Chiropractic Association. And today what we're going to do is going to go over a little bit about what chiropractic is all about and what animal chiropractic is all about. Chiropractic is the art, science, and philosophy of all things natural, and what we do as chiropractors, we examine the spine. The nervous system and the brain control all different parts of the body. The nervous system is the master control of the body. And when the nervous system isn't working right, our bodies don't work right. So what we look for is fixations in the spine. A fixation is when the spine, the normal motion of the spine, is interrupted by some kind of a stress, whether it be a chemical stress, a physical stress, or a mental stress. And what we as chiropractors do is examine the spine, find those areas of loss of motion in the spine, and reestablish proper motion. What that does, it reestablishes the function of wherever those nerves are going to, and those nerves and those body parts start working right. Animal chiropractic is basically the same things. Humans are bipeds, so we walk around on two legs. Animals are quadrupeds for the most part. They walk around on 4 legs. And they have their own unique issues and their own unique problems, but these procedures and techniques are very similar to what we do with humans. Okay, so what we're going to start with, an initial evaluation. And first we're going to look at the neck. So the vertebrae start from lower down, right below the skull, and these are the vertebrae in the neck called cervical vertebrae. And animals, most animals, humans, dogs, have 7 vertebrae in the neck called cervical vertebrae. And we're going to make sure that those bones are moving properly. And they're going to go on each side. And you can see that Willie is really sort of enjoying this. He likes any kind of attention that there can be. And I'm just going to make sure that all these bones are in the right place. And there's a little loss of motion in a couple of these. So later on, we're going to show some actual chiropractic adjustments or animal chiropractic adjustments on Willie over here. And we're going to move down to his thoracic spine, and the thoracic vertebrae are the ones that are in the middle of the lower back of the neck, and we're going to bring them up here a little bit. Good. Okay. And dogs have 13 thoracic vertebrae, and they have 13 pairs of ribs that hook right in there to the vertebrae. So the ribs can actually get misaligned in relationship to the vertebrae, and it causes different kinds of problems. So these kinds of problems that we're going to see in these dogs are they can be in pain, they can have loss of motion. A lot of times dogs will be doing something, all of a sudden they try to move in a certain way and they yelp. It's usually from some kind of a problem with their spinal musculoskeletal system. And most of the times those can be corrected by realigning the vertebrae and taking the pressure off the nerves. Where those nerves go to start working right. Okay, and we're going to move down to this lower back area. And all these names are the same as in people as in animals. These are the areas of the lumbar vertebrae. And animals, or dogs especially, have 7 lumbar vertebrae, as opposed to people who have 5 lumbar vertebrae. And again, we're just going to see what the motion is in these bones. And Willie's cooperating pretty nicely here. Going to see on each side what kind of motion there is. And when there's not proper motion, it means that those nerves are going to be pinched off or irritated or subluxated, as we call it. Okay, so we're going to move down from the lumbar vertebrae here to the sacrum, which is here. And we both humans and animals have sacrums, and we make sure the sacrum is set where it should be. And a lot of animals with hind leg quarters or hind leg problems have problems with these lumbar vertebrae, the nerves coming out of here, and the sacrum. Then we're going to go down to the coccyx area here, and the coccyx vertebrae in the tail. And also another thing that we look for is the TMJ, or the jaw joint. And with people, it can be a problem. Chiropractors see those problems all the time. Same thing happens with dogs, and less than people, but there can become issues from some kind of trauma. And if your dog isn't eating properly and is having trouble eating and chewing, a lot of the times those problems can be TMJ problems or jaw problems. And as I said before, the discs in the neck, which are the pads between the vertebrae, can herniate just the same way it can in people. And those kinds. We also see problems in the extremities. So it can be in the forelimb here, and it can be in the shoulder, which is in through here. It can be in the forearm, or actually the humerus, which is up in the right below the shoulder, which is down through here, or the forearm, which is down through here, or any of these joints. And all of these joints can be corrected. Okay, now what we're going to do is we're going to give an example of a chiropractic adjustment, perform a chiropractic adjustment on the dog. And first what I'd like to do is to show what we use to make the correction, which is a chiropractic adjusting instrument. This one is made especially for animals, and there's a very similar one made especially for people. And I use both of them on people and on animals. And what it does, gives a pressure or a thrust in a certain direction, but what it really does is, see on the spine, if a vertebrae is misaligned or out of place by this, you can see his vertebrae is rotated this way, this instrument just brings that bone back into place. It's very gentle, the animals really enjoy the feeling, and it works really, really, really well. Okay, we're back here with Willie, and we're going to demonstrate a chiropractic adjustment of Willie's cervical vertebrae up in his neck. Now, from palpating Willie, I know that he has a rotation of his third cervical vertebrae to the right side. And we're going to show what can be done to correct that. We're going to bring Willie around right here so he can face the camera, which he loves to do. And we'll take this instrument, and because this vertebrae, the place to move the vertebrae is way down here in the bottom part of the neck, I'm just going to bring this little instrument here. I'm just going to move it, and you can see he sort of likes that. Let's just move it right back into place. Then we're going to recheck it and see if he's got good motion there now, and he does. And that feels much better. Okay, now we're going to move down to his thoracic spine, and the vertebrae down in this area, and again, from examining him before, I know that this bone here is shoved over to the left side, and we got to take the instrument right here in the same way and just move that right back over. And again, you can see it's very gentle and pretty enjoyable for the dogs. And repalpated and re-motion palpated, and it feels pretty good now. So those areas, and that fourth thoracic area is very important, because those are the vertebrae that go to the lungs and different parts of the digestive system. So when those vertebrae are out of place, it can cause problems down through there. We'll move down the spine a little bit. Okay, Willie. We're going to go down to the bottom part of this area, and again, a lot of dogs have issues with bladder problems, and chiropractic works great with bladder problems. And also, as we said before, disc problems. So I'm palpating here, and I know that, again, Willie has a vertebrae that is rotated a little bit. He's doing pretty well down here, but just a little bit of rotation to the right on his 7th lumbar vertebrae. And I'm going to move that again, just right in that right direction. And that feels a little bit better. And then I'm going to move down here. And one thing that we do on a regular basis, do a little tail traction. You can do this with your own dogs. And again, you want to just do it really gently, and just put a little pressure, just elongates everything, takes a little pressure off, and just tractioning a little bit. And you can see that he sort of likes it. I'm not putting a lot of pressure on it, but that helps things out a little bit. Okay, and we're going to come down and make sure that all these joints are working right. And they feel pretty good before. And Willie gets out and runs a lot in the woods, and so he's in pretty good shape.